Good afternoon. I'm Alan Unell, and this is Healthcare Reform Advocacy, a sequence of videos, each addressing a problem in the healthcare system together with actions we can take to help make healthcare better for all of us. Today, we're going to discuss nursing because a few days ago we talked about nursing shortages, and one of the readers of our newsletter, Healthcare Advocacy, is a nursing professor and suggested this bears further investigation because the shortage is not really the problem. It's a much bigger infrastructure issue. So let's talk about that. According to the U.S. Government Bureau of Labor, registered nurses provide and coordinate patient care and educate patients and the public about various health conditions. The official description from the government website is going to be in the Healthcare Advocacy Newsletter in the description below, as will all the references and links to data. Now, registered nurses work in hospitals and physicians' offices, home health care services, and nursing care facilities. Some work in outpatient clinics, some work at work facilities and schools. Registered nurses usually take one of three education paths. They either get a bachelor's of science degree in nursing or an associate degree in nursing or a diploma from an approved nursing program. And I think the Bachelor of Science degree is where people would like to push for more participation, but that's an aside. Registered nurses have to be licensed, and of course we're going to have a description about how to get in school and get licensed in the newsletter. The median annual wage for registered nurses as of May 2022 nationwide was $81,220. However, there are problems in nursing. Recent statistics reveal that over 17% of new nurses will quit within the first year, and about 56% will quit after 2 years. That's horrible. There are a number of issues that make nursing particularly challenging. I will include a link to a National Library of Medicine article on the topic that highlights the top causes. But two of the most important are work overload and workplace injuries. So let's talk about the workload that nurses have. We've heard over and over again that nurses are given too many patients to care for, and that creates a strain on the nurses and can result in lower quality care for patients. As a result of not having a mandated nurse-to-patient ratio, registered nurses are consistently required to care for more patients than is safe, and that compromises patient care and can negatively impact patient outcomes. There is no federal government minimum safety standard for nurses, or think of it as a maximum number of patients for them to have on shift, except in California that I've found. California does have these mandated ratios, and the California ratios has proven to reduce costs for hospitals by improving nurse safety and job satisfaction so they stay at work. It reduces spending on temporary RNs, which I don't know if you've been watching the news, but they are extraordinarily expensive, and reducing overtime costs and staff turnover. So, regarding patient outcomes, there was a study done that compared the California standard, if applied in New Jersey. They found that 13.9% fewer patient deaths would occur in a surgery setting and 10.6 fewer deaths in Pennsylvania if in the surgery setting, if they would apply the California ratio of nurse to patient in the surgical settings. Again, the reference for that study is going to be in the description. It's worth noting that after the California law was passed, thousands of registered nurses came back to work. And a lot of out-of-state RNs came to California because of the low staffing ratios. It just makes for a better work environment. Now, according to the Bureau of Labor and Statistics, who tracks workplace injuries, this was a frightening number. There were 78,740 cases of non-fatal workplace injuries and illnesses that resulted in at least 1 day away from work amongst registered nurses in private industry. That is a 290% increase over 2019, when there were only 20,000 such cases. The increase in days away from work for registered nurses in private industry was driven by a drastic increase in cases due to exposure to harmful substances or environments. Another source of injuries that nurses are faced with is musculoskeletal. That is, they do a lot of pulling and pushing and lifting, and it's not easy to do. So the Veterans Administration, and as well as a few other sites, decided to implement some machines to give them leverage, especially in moving patients. And what they found was that nurse injuries from moving patients dropped 80% when these machines were used. I got to tell you, they're rare, but if you're in a hospital, bring it to somebody's attention. Generally, when employees are overloaded or stressed or on long shifts or in hostile environments, accidents happen and nurses suffer. And I should have mentioned that one of the causes of injuries to nurses in hospitals, workplace violence. I was shocked. I've mentioned this to some friends of mine that work in a hospital environment, and they said, oh yeah, we have violence all the time. Patients get upset, families get upset, nurses get beat up. I don't know what to say. It's just beyond belief. Okay, here's an extra credit action. I encourage you, if you're watching this, you're a healthcare advocate, to learn more about nursing. The National Nurses Union is working to make life better for nurses everywhere. Their website will be below. They are also strong advocates for universal health care, and you can join them, and I'll put a link in there where you can sign up with them and go to their meetings and help them make universal health care available for all of us. Okay, so let's get to the summary. There is not one easy solution to the problem of improving the environment for nurses, but there's a place where we can start, and that is with workloads. Since improving the workload seemed to work well in California, it's a big experiment, let's pursue it nationally. We need to let our legislators know it worked and that it can work nationwide. A bill has been introduced in Congress. It's Senate Bill 1113 or House Resolution 2350. It's the same bill in both houses. The Nurse Staffing Standards for Hospital Patient Safety and Quality Care Act of 2023. It's a mouthful, but it specifies safer staffing levels, and it will reduce the stress on nurses and save patient lives, as well as save money for the hospitals by reducing the need to hire expensive temporary staff or pay overtime, or deal with staff that takes off. It's expensive to hire new people. I don't want to go through the whole list of conditions in the bill. It's actually, a link to it will be, of course, in the description, but it calls out how many patients a nurse can be responsible for in any number of different situations within a hospital. So here's an action for us to take. We can educate our representative in Congress and our senators because they may not be aware of this. Let's let them know. Senate Bill 1113, HR 2350 will set safe standards for nurses in hospitals, and that'll make for better conditions for all of us. And while they're thinking about this, we should ask them to also pass Senate Bill 2840, the Bipartisan Primary Care and Health Workforce Act, that's looking to put another 60,000 nurses through training. Okay, all of this action is easy to do. All you have to do on your cell phone, if you can text to 50409, SIGN, S-I-G-N, PIHEWR, and you'll send an email to your representatives to do that. And of course, all the details will be down below in the description. So, like, share, Send your comments in the comment place or send me an email. The description, my email address will be in there. And I hope this was valuable for you. Have a good day.